You are actually slap bang on time, turns out. So thank you for being here. And what I'd like to do is just to check in with you and see who are the moms who have moved their kids over to adult rheumatologists. Okay.
Um, yeah,
Okay. So is it Marley? Marley,
Marlies.
Marlies.
Marlies,
Okay.
yes.
And
And
Mandy and Heidi.
correct.
Okay, great. Thank you. So I'm going to go over to you and ask you if you would please share your experience with us. Um, uh, uh, and I don't know, maybe how should we do this? Would one of you like to share your story first, or are there any pressing questions that you'd like to start with anybody who is moving forward into this journey with their kids?
Happy to share, and I don't mind starting if you want me to start.
Okay, great. Mandy, if you would start, that would be fantastic. I think the one question that did come up earlier on a mom from a mom who messaged me on WhatsApp, she said, "My son is 17, or my daughter, I'm not sure, is 17. Is this us?" So maybe we can start there.
Well, definitely, I'd say we pushed it a little bit too long. Eventually, our rheumatologist was kicking us out. My daughter's 20 now, so we really pushed it way beyond. But I think it's also part of the medical aid. Won't cover you as a pediatric rheumatologist when you're 20, so you should still be a teenager, I think. But yeah, so Kayla, we've basically been with the same pediatrician since Kayla was 14 months old. So it's 19 years of the same rheumatologist. So it was very daunting for Kayla and I. Very yeah, we went in not knowing what to expect, how it's going to go, and it was actually a wonderful experience. The rheumatologist totally got where we were coming from. She totally understood that this was all new to us. She totally welcomed me along with Kayla because I thought, oh, she's not going to like that the mom's now tagging along. She totally was happy. She did direct everything towards Kayla. She basically said, "Welcome to Kayla," with big open arms, and then directed everything to Kayla and kind of like, I look at ask questions and throw in a bit of history, but she wanted Kayla to take point, which was important for me too. I wanted Kayla to take point because I want her going forward to be able to message this new adult room and be in contact with her, just like she was with Dr. Fella, or just like I was with Dr. Fella, my ped here in Joburg. I want Kayla now to take points. But so far, it's been a very positive experience. We've only had one appointment, so it's very new to us. That's why I'm actually keen to hear more from others that have had maybe a longer experience. So, yeah, it's just to see now how she will manage Kayla's medicine. Will she change anything? For now, she's keeping everything exactly the same. And we'll see going forward if she changes anything. But so Kayla's, I suppose I should give you the background of what she's on. Currently, she's been on a whole slew of things, but currently she's on Symphony, which is a biologic, and she's on that particular one because she also flares in her eyes. So she's it's keeping it holding her well. It's a monthly injection that she injects herself, and so she's got in chemical remission basically, and has been for a few years on Symphony. She has minor like little flare things. I think it's stress related, and we think it's more like maybe a tendonitis, but no major flares for many years now, and she's doing really well on Symphony. So I'm hoping we carry on, and it's just starting a new journey with a new person, and it's still going to be as good and successful as what we had here in Joburg. So my daughter's in Stellenbosch, by the way. She's studying in Stellenbosch at the moment. So she's now with Dr. Stella Buerta in Stellenbosch. And that's my story. I don't have any questions, or if someone else wants to share their story.
Thanks, Mandy.
I've got a very similar story to you, Mandy.
Oh,
Uh,
really?
yes, it's actually strange. My daughter Anne, she was with Dr. Falla and she's also turning 20 now. And we also had our first appointment with our rheumatologist. My husband also has arthritis. So he's with Dr. Benita. So she's also studying in Stellies, but we kept it with Dr. Benita up here because we know her. And we'll still see whether that's a good call, having the room up in Joburg and the child studying down in Stellies. But we also had a very productive first meeting. It was an hour consult. Dr. Faller forwarded a report about Anne's condition. And Anne is also on Symphony. It works
Okay.
well for students because it's once a month.
Mm.
And, we alter wherever the injection needs to go, whether if she's at home, it comes this side. And if she's at Stellies, we drop it off at the local pharmacy there. So, yes, it was, I think that it's not the rheumatologist's first rodeo, so they know exactly what they're doing. I thought Dr. Benita were very thorough, and we actually picked up on psoriasis that we never diagnosed with Dr. Benita. So, yeah, it was all in all, I think, rather positive. What I did find is you do new vaccines when you're older. I don't know if you have the same with your rheumatologist, but Anne had to do the pneumovax, and then in 6 months she has to do the Prevnar, and she also had to have her Menactra updated. She had her Menactra, I think, in 2015, and Dr. Benita said we need to um, do the Menactra as well.
Marlies, what are those? Remind me. I have no
Oh,
recollection.
okay,
To
so the
remind me.
pneumovax, it's I think it well obviously lung bacterial. I don't know if it's oh sorry, this is my son. Let me just switch him off. Um, it's all lung related. I know you give the Prevnar as a child. Sorry, there we go. Um, so it's both lung related vaccines. I also didn't know about the pneumovax, but you need a script for it. Sorry. And the Menactra is meningococcal meningitis.
Okay.
So, yeah, because they are in res, and I think that is something that you pick
Yeah.
up when you are young. I am so sorry.
Do you want to take it and
Sorry, it's my
Yeah,
son.
I can.
Let me just switch my phone off. Yes, so apparently, and I asked Dr. Falla, why didn't we do it with our kids with her? Because we never did the Prevnar. And she said it's only indicated when they're adults. So it's not in the lungs, doesn't appear to be a problem when they're younger. That's that's what I understand,
okay.
if I understand it correctly. So it's Prevnar is pneumococcal. Um, Yeah, it's a yeah, but let me quickly, sorry, let me try and get you a better answer.
Thanks.
But that was the
That's
three.
brilliant. I appreciate that. We weren't told that at all. So I'm going to follow up in our next appointment.
Mm,
And
Mm.
Marlies, tell me, it sounds like your daughter Anne got a thorough examination
yes,
from Dr. Benita. Um,
yes.
Mandy, you too, if I remember correctly, when we chatted about
Mm,
it before.
yes,
Can you share a little bit more about that? And then we'll go to Heidi.
sure.
Oh, yeah.
There was the one thing that Kayla was concerned about is
Yeah.
will the adult rheumatologist be the same and diagnose the same, check her joints and make sure, because it sort of gives her kind of peace of mind when someone's checked it. And
Wow.
she was exactly on point, exactly how Dr. Feller was. She felt every single joint and she said, oh, Kayla, aren't you a little bit tender here? Aren't you a little bit? And she actually was exactly in those points. She was a little bit tender on that day. So very, very thorough, excellent. She actually took us through a whole lot of flip charts as well to try and give us even more information. So it was really, really a good, like your experience as well, a good hour-long session, very thorough.
Very thorough and looked at the lungs particularly well. Apparently, at their age, and I could be wrong again, you don't need to do the blood tests. They actually um, they check the lungs by listening to your lungs and looking for symptoms. So it's not blood tests anymore. So thoroughly looked at the lungs, and I also thought Anne was checked out from top to bottom very thoroughly. And also the Dr. Benita shared a lot of information about the arthritis and that kind of thing that was quite new to us. Sometimes you forget these kind of things, things that you should have known.
Yeah.
Yeah, I don't know if there's stuff that we should know. But there's just so much to know that
Oh,
you know, it's just such a volume of information.
mm.
And tell me, Marlies, you mentioned the lungs. What are you referring to there? Pardon my ignorance.
No, because I'm not sure whether it's only because she's on biologics, where
Okay.
you are obviously more prone to TB,
TB. Yeah.
but I'm sure you are also more prone to lung infections.
Okay.
If and I presume when you become an adult, and I'm not 100% sure why,
Yeah.
but I know I've asked Dr. Falla and she said it's not an issue in the children. That's why we don't vaccinate them. So I will ask that again because usually when I walk away, I've got a million questions that I should have asked whilst I was there.
Yeah. Yeah.
Yeah.
Yeah.
You'll
So
miss that.
sorry, could I
Yes.
just ask something?
Oh, sorry,
So
Marlies.
Marlies, are you saying that they don't have a TB blood test?
Yeah, they don't do the TB blood test. Well, Dr. Benita didn't do it. She said
Okay.
it's not necessary. They do a physical exam and she listens to the lungs and that's enough for her. So it's not the blood test anymore that you do annually when they're on the biologics.
Okay.
Interesting. We didn't have that experience, but Kayla had just recently done bloods to renew her meds. So I'm going to ask that now when we do our 6 months renew. I'm going to ask all these questions. So thank you very much.
Yeah.
It's a pleasure. I hope I'm not talking a lot of nonsense.
No, definitely not. It makes a lot of sense,
Makes
actually.
sense, yeah.
Helen
Yeah.
has
My
asked, how
daughter's
come the
constantly
lungs?
sick. My daughter's constantly sick. I think in Stellenbosch, well, in a student environment, it's like nursery school. They all pass around these germs, so they always got colds and head
Abs
colds.
Absolutely. I think they go home and then they just go bring all their germs back to Stellies and then yeah. No, Anne she just got there and it was a week and she was sick. So yeah,
Yeah.
we know the
Kayla
drill.
the same. Our story is very similar.
So Helen is asking, how come the lungs? I know they're susceptible, but I didn't know they had to have special vaccines.
Yes, it is to protect them because I think they can protect themselves to a lesser degree because they're on biologics. And that I know Prevnar is for bacterial infection.
Okay, and this
I'm
is
not
when
sure
they
the
are,
pneumovax.
and this is when they're over the age of 18, or when
Yes,
they
that
move over
that
to
that
a,
starts to factor in.
yeah.
Yes.
Okay. Okay. Heidi, what is your experience with all of this?
So I've got two daughters who've transitioned to adult rheumatologists. My oldest daughter's 23 already, and she's been in a medical remission for probably the last 3 or 4 years. So she was with Dr. Falla, and she went overseas for a gap year, and Dr. Falla only transitioned her when she got back. So she's also around 20 years old. And she moved to Dr. Clemenson first, who was fantastic, but then emigrated. She left and she went to England. So what I did do was get hold of Dr. Falla because, she's got such a good idea of her patients, who they are and what works for them. Because if you ask for recommendations, you get a million recommendations from a million directions. So she said she had originally recommended Dr. Clemenson. So then she said, there's a new rheumatologist downstairs from me. She's young and quite newly qualified, Dr. Joyce Zicki, and I trust her, and why don't you try her? So we went to Dr. Zicki, and she's been fantastic. So my older daughter's more or less in remission. She now has an online consultation because she'd seen her for a 6 monthly checkup, I think 2 or 3 times, and there's been no change. She's holding stably. So, it was so much easier for her just to get on the phone and have a telephone consult. My younger daughter is also, so she just moved directly to Dr. Zicki. Once we had one with Dr. Zicki, it was a whole lot simpler to move her. She is on a biologic, and she did still have to do the TB blood, and Dr. Zicki didn't suggest any additional vaccines. And she is in communal accommodation, so it is quite interesting. She's overseas at the moment. and she's sick. It's winter and she's sick. But I do think she's on some pony. She's on about her 4th biologic now. She's on Cosentyx. She failed Enbrel, then she failed Humira, then she failed some pony. Now she's on Cosentyx, which has been fantastic for her. But I do know in some pony she got sick a lot of the time, so maybe it's connected to the actual biologic. And in fact, she stopped taking the immune suppressant. She was taking Rumalef, but she was getting sick so often that Dr. Feller said, stop taking it and just take the biologic. But the transition is smooth. I think the pediatric room will guide everyone through it. She does a thorough report so that the doctor receiving them knows exactly what the patient, who the patient is that they're getting. And, I think at first consult with these adult rheumatologists, they just as thorough they need to be, to actually, and they do an assessment in their own rights, because JIA is a general diagnosis. So my second oldest daughter, she had a revised diagnosis to ankylosing spondylitis, because once you're no longer juvenile, you actually get, whether it's rheumatoid arthritis or ankylosing or whatever it might be, you get a diagnosis, which is something else to deal with for these kids, and not always a lovely thing to deal with. But it's part of this transition to the adulthood.
Heidi, can you explain that to me? What do you mean they get a diagnosis?
So, JIA, Juvenile Idiopathic Arthritis, which is what our kids are all diagnosed as, means it's like a general, it's a general umbrella term for all these all these autoimmune diseases that look like arthritis. But the rheumatologists don't make a specific diagnosis of the type of arthritis which is affecting the child.
Okay.
So once they old enough, then they actually get a diagnosis of the type. It stops being a generic umbrella terms, and it becomes a specific term.
And Heidi, tell me, okay, so Kath, sorry, I see you putting up your hand. Thank you. When you say that it's a whole thing for the kids on their own, explain that, please.
What to deal with? So ankylosing spondylitis is quite a hectic diagnosis. It's a back arthritis. It's quite debilitating. So, it's and they all go to Dr. Google. You can't prevent that. They're young adults. They have minds of their own. They're not, they're certainly going to do their own investigations. And, they need to deal with how that diagnosis is going to impact them going through their lives. And it's on a different level to how they've dealt with it going through school and just on a day-to-day basis that they've had before. My oldest daughter, it didn't really affect her so much because, she's in remission. It didn't really make any difference. But yeah, it can be something more to deal with.
Okay. Interesting. Kath, what were you going to share there?
So I just wanted to expand on what Heidi's saying. So JIA is a broad term. It is a category of diseases, but there are 7 subtypes of juvenile idiopathic arthritis, and a juvenile a pediatric rheumatologist will typically diagnose with a subtype. So they might diagnose oligoarticular or polyarticular. Ankylosing spondylitis in an adult is usually enthesitis-related arthritis in a child. So it's enthesitis-related JIA, or sometimes psoriatic arthritis, and the psoriasis only comes later, but it's more hips, back, those sorts of things, and there's undifferentiating these. So typically a ped room will give you a subtype, and JIA is the broad category. The tricky thing with an adult rheumatologist changing the diagnosis is that you then get a different ICD-10 code.
Correct.
If your child is continued to be treated on juvenile onset arthritis, then you still have a PMB. If an adult rheumatologist changes it from juvenile onset arthritis, which is a PMB, to the naming convention for enthesitis-related arthritis in an adult, which is ankylosing spondylitis, more or less, then you change ICD-10 code and then you lose the PMB. But I want to, my understanding of this, and having spoken to both adult rooms and pediatric rooms, is this PMB thing is ridiculous, because essentially you have immune-mediated inflammatory arthritis. So whether you have enthesitis-related JIA, or if you have ankylosing spondylitis as an adult, or if you have rheumatoid arthritis, or if you have psoriatic arthritis, what you have is immune-mediated, which means through the immune system, inflammatory arthritis, whether you have it in your finger joints, or whether you have it in your knee joints, or whether you have it in your lower back or your shoulders. You have inflammatory arthritis from your immune system. And for reasons that remain completely obscure, they include some as PMBs, which is a prescribed minimum benefit, which means you have additional protection, and some they don't. Ankylosing spondylitis, which is an adult form of the arthritis, is not a PMB. I personally am going to make sure that when my daughter transitions from a pediatric rheumatologist to an adult, that she keeps the same ICD-10 code. These naming conventions change. If your doctor wants to, let me say this, if your doctor wants to re-diagnose or change the diagnosis, ask them for evidence that the disease has changed. Ask them to show you where the disease has changed. At what point did the form of arthritis that she had at 14 become something different now that she's 20? Which additional joints? Where is the evidence that the disease has changed? If it's become a different disease, which is odd to me. I don't know how it becomes a different disease. It's immune-mediated inflammatory arthritis. But just be careful from a PMB perspective, because you just lessen the protection that you have from a medical perspective. And it's all just inflammatory arthritis from the immune system. It doesn't matter what the naming convention of the day is. So that's just my only, so Heidi, that's the only thing, is just to bear in mind. So in children with enthesitis-related arthritis,
I didn't know it was a choice, so to speak. Like, I didn't know it was something you could argue the doctor on.
I know, that's why I'm bringing it up. Yeah.
And I knew it was going to affect her PMB, and I was very upset about it, because, I mean, we have to stay in classic comp in order to get her, the biologic. Yeah. She's now over 21, so it's got all those impacts.
My understanding is it remains juvenile onset inflammatory arthritis. That's what it is. It's juvenile onset idiopathic arthritis. JIA is a general broad term, but there are subsets. 7 different subtypes of JIA, which are all included in the PMB code, one of which includes enthesitis, one of which includes psoriasis. There's undifferentiated. So there's a lot of space to maneuver within the JIA subtypes. And it's not so much about arguing with the doctor. It's about the adult rooms are trained in one way, and they're not trained typically in JIA, and the ped rooms are trained in a different way, and they don't often cross over. They sometimes go to the same conferences, but I've been to a number of these conferences, and the ped rooms go into one room and the adult rooms go into another room, and they are educated on their respective names for those diseases, which are the same diseases because it's the same immune system in the same child in the same joints. So what I'm just saying is, don't fight with the doctor. Don't just do, that's really not. I agree with you. Sorry, that's not what I was trying to imply. But just ask them to just think more broadly about it, specifically from the impact that it'll have on you as a family from a financial perspective, and the fact that PMB includes some types of inflammatory arthritis but excludes other types of inflammatory arthritis is beyond ridiculous. And it is something that we are actually. We do have a campaign together with the Axial Spondyloarthritis Association of South Africa, which I can put you in touch with. Great organization run by a woman called Miranda van Dam. She has axial spondyloarthritis, as do both of her boys. And she has been working very hard for years to get ankylosing spondylitis included in the PMB code. The fact that it's not is insanity. But that's the reality of it. And it seems insane to lose out on the protection of a PMB code because adult rooms call it one thing and ped rooms call it another. So that's all I wanted to say is just familiarize
That's
yourself with
good.
those subtypes of JAA, because all of us, when we transition to an adult room, they're all going to want to change it to ankylosing spondylitis. None of our children have rheumatoid arthritis. The fact that they have JAA, if they had rheumatoid factor, they would have been diagnosed with rheumatoid arthritis, even at 2. But it's very, very rare in children. I've never encountered a child who was positive for rheumatoid factor. So they're not going to suddenly develop rheumatoid arthritis as adults. What happens is that the adults call it ankylosing spondylitis and the peds call it JIA. It's the same thing. The disease doesn't undergo a metamorphosis unless it does, in which case have the conversation with the doctor and say, I'd like to understand this better. In what way has the disease changed? Does it mean different joints? Is it a different part of the immune system? Will we treat it differently? Was it always ankylosing spondylitis, but we just called it JIA? That's a very good way of phrasing it. Like, at what point did it change? And it's not so much about confronting the doctor as just wherever possible, making sure that you still have that protection.
Yeah, which we've lost at this stage.
You can have it. You can have it changed. I can help you with that.
All right, thank you.
Yeah, we could definitely.
Well,
It's just
take you up on that.
assuming Dr. Zeki would be happy to do that, but I'm sure if we had a chat to her,
yeah, she's very
let's have
approachable.
the chat and see. Yeah, let's see how she responds.
Yeah, and I think Dr. Feller is sending quite a lot of her patients to her.
Yeah.
So it's worthwhile having that conversation. She's got space, she's accommodating, and she's very nice.
Yeah, and
She is
like
great.
you say,
I've met
she's
her.
very
She's wonderful.
approachable. I think it's important that your doctor is approachable on stuff like this as well.
Yeah.
Yeah. And does anybody have questions for Kath about anything that she's brought up now, any of the terms, any of the nuances? It's a minefield, this medical aid thing. Monica, Teresa, Claire, Marlies, Helen, any questions? Mandy?
Yeah, I have a question. It's not directly related to what Catherine was speaking about, but Dr. Feller recommended 2 rheumatologists to me for my son Dylan. He's 20 years old. He's in his 3rd year at Tux. So she recommended Dr. Ramit Bonella, and then she also recommended Anita Lai. So, sorry, it was Ramela Bonita. So those are the 2 rheumatologists. Now, I know Marilise said her daughter's been to the one, but I just wanted to know if anybody has any sort of feedback on Dr. Lai, or has anybody been to her, or does anybody know of her?
No.
Okay.
But yeah.
Yeah, I suppose that's another question, is how do referrals work? And it sounds like in the experience of the moms who have transitioned, the referrals come from the ped. All your pediatric rheumatologists have been Dr. Feller.
Yeah, with us, my husband was with Dr. Benita prior to our kids going to Dr. Feller. So we know her and we have a relationship with her, and we've been very happy with her. She works well with an adult. So
how
that's
tricky is it to get an appointment with her? How tricky is it to get an appointment with her?
Not that difficult. I don't know if I was lucky, but I know an initial appointment that's an hour long, because she wants to do a thorough exam when you see her for the first time. I know that can take some time. Often I know if I always ask, put me on a cancellation list, and that works rather well because they actually do put you on a cancellation list. But if everything runs smoothly, hopefully we can see Dr. Feller in the holidays, but one never knows with arthritis. So hopefully, we can stick with her. Yes. Yeah, but she's if you email, she gets back to you within 2 or so days. If it's really urgent, her frontline girls are very competent. They will pass on the message and she'll get back to you for instance, Anne jumped into the fountain at their res and she cut her foot. And I was instructed just to hang on with the vaccines. And so I asked, listen, should I hang on with the tetanus? And I got a response immediately and said, no, go do the tetanus. So, yeah, so when you need to communicate quickly, there is a way.
With Dr. Benita.
Yes.
Okay.
Thanks. Yeah, because Kayla might
And
eventually
where
come
is she
back to
based?
Joburg. Yeah, that's why I'm asking, because she was my number one. Also, we were going to choose a Johannesburg rheumatologist, but I just thought I'd heard that it was quite tricky to get appointments, and you wait a long time for appointments. But if that's not your experience, and that's great, because if Kayla comes back to Joburg, she's my one that I would choose, I think.
Yes, yes. No, I don't know well, I've never experienced. My dad also has arthritis, and with my dad and my husband and Anne, it's been quite easy to get appointments. Listen, I know initially you wait for a while, but if you're in the system, it goes easily.
And
Okay.
where in Joburg is she, Marlies?
At the Joburg Surgical, the new hospital there in Northcliffe on Bays Nordia.
Oh, okay. Okay.
Yes. Yeah, very nice new hospital.
Okay. Any questions on medical aid, on anything that Kath might have referred to, referrals?
The one thing I noticed is obviously when you go into when they see an adult rheumatologist, it's a lot more expensive than what the pediatric rheumatologists are. How much of the medical aid, how much is that covered by the medical aid?
About the same.
Oh,
I don't know.
There's a question. Okay, so theoretically, the medical aid is supposed to, so there are a lot more adult rheumatologists than there are pediatric rheumatologists. So the thing with the ped room is there are only 3 in Joburg, for example, and they all charge more or less the same. And they are specific to treating juvenile arthritis, and so you can make a motivation that that's the most appropriate treatment, even if they charge more than what Discovery would normally pay for just a pediatrician, for example. So many medical schemes don't pay the full pediatric rheumatologist, and you have to fight every single time, but they are supposed to, and you can get it done. The same is not true for adult rheumatologists because there's so many more. So if there's an adult rheumatologist in your medical aid network who does charge the medical scheme rate, then that's the rate that they will pay. If you choose to go to an adult room who charges more, then they don't have to pay the difference. So assuming that there is a doctor within reasonable to whom you have reasonable access, so you don't have to drive 30 kilometers to see their doctor. So if their network doctor is in a different town or is 40 kilometers away, or for some other reason it's inaccessible, then you can make a motivation for a more expensive doctor. But as long as there is a rheumatologist who charges the medical aid rate, they are justified in saying, if you want, you can always go to that doctor. Does that make sense what I'm saying? There are a lot more adult rooms than there are ped rooms. So for ped rooms, it's pretty easy to get it paid in full, assuming you're prepared to put in the legwork and all the admin. But for adult rooms, it's a lot more challenging. So it's worth checking with your, based on your it's still a PMB, but they will only pay for the most cost-effective adult rheumatologist in your area, so closest to you. That's all they have to pay for. You can't actually get them to pay for any more. So if you choose to go to the most expensive adult rheumatologist in your area, then the difference between those is for your expense. So it's worth just finding out. But there will be adult rooms that are networked into your medical schemes, funding processes. So it's worth finding out who those are.
Yeah,
and that makes sense to everybody. I sort of hashed that explanation. Everyone understood that.
Yeah. And do you reapply for all the PMB, the whole chronic application again when you see the adult rheumatologist? So does that whole application go through again?
To be honest, my child hasn't transitioned yet. It depends if they change the diagnosis. So in the case of where the children's diagnosis has changed and the code has changed, then there would be a new chronic application. In this case, it wouldn't be a PMB. So if your child's diagnosis has changed from juvenile idiopathic to ankylosing spondylitis, It is a completely new chronic application, and it's not a PMB. But I don't know the answer to the question because I haven't gone through it yet. So we already have an existing chronic application in place. I'm assuming that remains in place because assuming that ICD-10 code remains in place, it's just a change of who's prescribing and who's charging, who's invoicing the reviews.
Yeah.
But in that case, I can't imagine why you would have to reapply. But honestly, I don't know. I haven't gone through it yet.
Mandy,
Our code
you
stayed the
wanna
same.
release?
Yeah, our code stayed the same, but we still got the ICD-10 code, and it's we just have to do our usual renewals exactly as and it was all went through fine. So no change on that.
So Mandy, that's a really, really good point. So Dr. Stella Buerto, who is Kayla's rheumatologist in Cape Town, she's actually the current president of SARA, which is the South African Arthritis and Rheumatism Association. She is absolutely fantastic. She really is just fabulous. If I had a choice of any rheumatologist in the country, I would take Ella to see Dr. Stella Buerto. And she kept the ICD-10 code the same. And that for me is quite telling. So
That's very
it's
telling.
again, not about challenging your doctor, telling you how to do their job, but introduce the conversation, because it might just be something they haven't thought about before. And they're not thinking in terms of PMB necessarily. They're not thinking about continuity of biologics. They're not thinking about the impact of the continuity of biologic. It could be that if you change the ICD-10 code from JIA to an adult rheum subtype, that in some families, that means not being able to afford a biologic at all, which is catastrophic for a child who's stable on a biologic. So just introduce the subject. Call me up front if you want to firm up on some of these terms and just your general knowledge of that you feel more confident. You're welcome to call me at any time. But I do think it's important, and the fact that Stella did it, there you go. That's great. Nice.
So does that then mean, Mandy and Kath, that if this Dr. Stella didn't change the ICD-10 code, that means that she still has referred to Kayla's arthritis as juvenile onset arthritis? Am I understanding correctly?
It's JIA. It was diagnosed as JIA and remains JIA.
And remains JIA.
Dr. Fallis, just when we had our last appointment, she just said she actually made a point of the code, and she said you can keep this code. It covers both ped and adult. You do not need to change the code. So it's interesting that this has come up because I realized it was such an issue. She just said it to me, and I'm glad she did say it to me because it obviously was important. Yeah,
sure. What I find interesting is that we're
it's
talking about the medical aid so much in this conversation. It's taken us probably 20 minutes to cover medical aid and only 25 minutes to cover protocols, referrals, first appointment, psychological impact, I don't know, handover. Medical aids are quite a thing. Anything else? Anybody? Questions, comments, Claire? I can see your finger moving over there, but you're not coming with me.
Yeah, I'm thinking around all of this because I myself have got autoimmune arthritis. I was diagnosed after Dan, and I see Dr. Harsbrook at Four Ways Life, who's really lovely. And I had a conversation with her about this as well, because Dan is 17, what happens when he becomes an adult? And she said to me, whatever you do, make sure you keep the JIA diagnosis with whoever you see. Because of the basket of care, it means that he should still get covered even if he can't afford the higher plan. I, unfortunately, am diagnosed as an adult with ankylosing spondylitis because that's what's most applicable to me. And she said the reason why she didn't put it through as a rheumatoid or that is in terms of what medication is available to the diagnoses. So mine turning out to be quite difficult to treat. So because she's given me that diagnosis of ankylosing spondylitis, has got other options of biologics, which she would have been limited to if she diagnosed me with rheumatoid, which is a PMB. Whereas apparently with the JIA, they have a much larger range of biologics that would be covered from medical aid as opposed to an adult rheumatoid arthritis, PMB diagnosis. I don't know if that makes any sense.
Yeah, it does.
Thanks, Claire. Yeah, it's just also interesting that the very same doctor has told Mandy one thing and has kind of almost, I don't know, forgotten to tell Heidi, if I'm not.
Yeah. I wish she had warned me. But we
That's
did move, like it sounds like Mandy just moved this recently. We moved over a year ago, if not almost 2 years ago.
Yeah, and also our
So,
doctors are human. They
yeah.
can, the conversation
So it
goes
might
on.
have become more of an issue, which is why, like Gail said, be careful not to change the code. I'm quite sure that, yeah, she would have warned me if she thought it was going to be an issue.
Yeah.
We moved in Feb, so it's very new.
Yeah.
And some of the adult rooms have very strong feelings about it as well. So it does depend on the adult room. And that's why the conversation is an important conversation to have in a non-confrontational way. But if you do find an adult room who is insisting on changing the ICD-10 code, if it were me, I'm going to get a second opinion from a different adult room when the time comes for Ella. Until someone can explain to me in what way the disease has changed. Ella still has arthritis in her knees and her left ankle. It's never moved to another joint. It's never been in her lower back. It's never been in her hips. She doesn't have psoriasis. So unless they can explain to me how the disease that started at 2, which is exactly the same at 16, and unless it changes between now and her 18, it's the same disease. So I don't understand this idea of it changing, unless it does. And I'm not a doctor, so maybe it does, and maybe it does in some children, not in others. But the reason the basket of care for JIA is so much broader is because of all those subtypes. So you have access to the ankylosing spondylitis drugs under enthesitis related and the psoriatic. RA is a more limited, because RA is a far more specific thing.
Yes.
So that's the reason. I wanted to ask the mums who have transitioned already, because Ella's 16, she'll be 17 later this year. We have very limited options here in Neisner, and also, she's with Gail in Joburg. So if she needs to, then she's been flaring terribly for months and months and months. So we have to fly her to Joburg and fly her back. And we only have one adult room on the whole garden route. So I guess he'll be it. He's very good though. He's lovely. But I just wanted to ask how important did you say to your children going into it, tell me how you feel about this doctor, and if you don't feel like there's a rapport, we'll change? Did you give them an option of a second choice?
Yes, we had the conversation because we were warned that Dr. Buerta wouldn't be so happy with me going along to the appointment. I don't know, it was someone else didn't have a good experience apparently. Anyway, we did not have that experience at all, but Kayla's very anxious. So when she heard Dr. Feller saying that, she immediately got anxious about the appointment. So I said to her, she must, don't worry about it. I'll say that I'm just here to listen, we'll just approach it carefully. And if she's not happy, there is another doctor who apparently is amazing in the same facility, so we can change. This is just, and it's also temporary, because she's going to be in Stellenbosch for 3 years, and then maybe she comes back to Joburg. She might not. Who knows? But she was very happy with the experience. But I did give her the option, because we were a bit apprehensive about how we would be taken how the first appointment would go. Yeah. But Kayla's very happy.
Good.
Hedy?
Yeah, no, I went with my girls, and if they didn't like her, we would have made another plan and found someone else. I'm a strong believer in being able to relate to your doctors and actually have a conversation with them. And my girls know this, so we don't hesitate to get a second opinion if we need one. And if they'd not been happy, we would have also transferred to another doctor, which is looking.
Oh dear, no, don't. Let's call me tomorrow and we can have a chat and we can
Okay.
undo this. We'll undo all of this. Don't worry.
Marlies, what about you?
We never had the conversation, I think, just because we knew Dr. Benita through
Okay.
my husband.
Yeah.
So it was never an issue. There was never any apprehension, so yeah, I've been with my husband to his consults with Dr. Benita, so we know her, and we've got another daughter with her, and then Anne is in the second one, so it's all easy. Yeah, it wasn't, listen, if Anne insisted on somebody else, but I don't think she would have. So yeah, no, we're happy.
Okay. So we've got 10 minutes left of our share and care. I know I ate up 5 minutes of it or 6 minutes of it, so I'm happy to stay until X past 9, no problem. Teresa, you and so Helen's been commenting on in the chat. Teresa, we haven't heard anything from you. How are you? How old is your child? What is your thinking going forward?
Yes, Christopher is now 17. He's turning 18 next month. So we in that situation now. We need to go to an adult rheumatologist. We're seeing Dr. Fallon now on the 1st of April, and I will discuss everything with her and ask questions. I've written down everything now just to get a clear picture. And so my main concern was also just how to transition from the pediatrician to the adult one. But at the end of the day, I will leave the decision to him to decide with which doctor he feels comfortable. And and then the medical aid questions was answered. So I'm quite comfortable for now. If I've got any questions later on, I will contact somebody on this group just to give me more information or help me. But I feel fine with everything so far. And I believe that we will have a smooth transition. My only question is, there were 2 parents now that said their kids were 20 when they only moved over. Can we stay with Dr. Fowler until the age of 20, or do we have to move when he's 18?
I can jump in because my third daughter's turning 18 this year. She's a matric. And from previous experience, Dr. Fowler's happy to keep them through matric and not disrupt their year medically. In fact, she likes to help manage the arthritis through the stress and through the tension of the matric year. So I think inevitably they're older than 18 when they leave her.
That's fine. So we've got another year with her. Okay.
Yeah.
Yes, and Anne has been unstable on her meds in her 18th and 19th year, and I think Dr. Fowler wanted to sort that out before we moved on, and that's why we stayed on until, well, she's turning 20 now in May. So that's why she also her first year of varsity, we also saw Dr. Fowler, and we only changed over now in her second year.
Yeah, it's like makes sense. Last year of school, first year of varsity.
Yes.
Or first year of whatever you do after school, makes sense to keep things as stable as possible. From what I understand, though, kids can move over from the age of 16 and they are considered adults.
Yeah.
Kath, I don't know if I'm wrong.
In the public sector, they actually are forced to move at 12. So for example, if children are treated at Red Cross Children's Hospital in Cape Town, where they receive spectacular treatment, they are forced to leave the ped rooms at 12 and go across to Grooteskies to the adult rheumatologist. Sure. So theoretically, medical aids could actually stop paying for pediatric rheumatologists, or if there's an additional fee, which it sounds like there isn't, from the age of 12, because the PMV doesn't really cover anything outside of what you would get in the state. But yeah, in the private sector, I think at 18 to 20, I think is fine as far as I know. Nobody's getting any pushback. But in the state sector, it's 11 and 12, and they're very strict about that.
So from what I know, just anecdotally at Barra, the doctors are quite happy to keep the kids until they're a little bit older. So I don't know if that's maybe kind of like just from their training here in the Gauteng area, but it seems like they are able to keep the kids until they're a little bit older.
It might be provincial health, Laura. I'm not sure. At Gauteng versus Western Cape.
Yeah.
I know poor old Kate Webb has been pulling her hair out trying to hang on to her patients, and they're not allowed to treat them at all. It's been very tricky for them. But I don't think it's an issue in the private sector. I think you just keep going. I'm trying to think. I have 2 stepchildren who are in their 20s, and at a certain point we had to switch them to their own plan type with Discovery. So that's probably the crossover. And I think that was only 21, to be honest.
When they're 21, you start having to pay for them. Yeah.
Separately, on their own thing. Yeah. So it's probably around that.
Okay. Anything else, Teresa?
No, I'm fine for now. Thanks.
Okay, thanks, Teresa. Helen, anything from your side? I don't know if you're there.
Yeah, I'm good. Thank you. That was super interesting. Thank you very much, guys.
Okay,
I think we'll stick with Dr. Fowler for a couple more years till we have to move.
You know, you can stay till you're 20 because that's when
Yeah,
you
no,
keep us
yeah,
out.
we'll do that. At least we'll get through matric and then we'll think about it. Yeah.
Yeah. Claire, anything from your side? Any questions,
No,
comments?
good. Also relieved to hear there's a bit of a breathing room because Dan is very complicated and I dread moving him just because Dr. Fowler's been his safe space and the only doctor he's trusted in a myriad of doctors. So just to know that we've got a few more years is a huge peace of mind.
Mm. Thanks, Claire. Monica, anything from your side? Questions, comments?
No, it was just thanks. This was really, really helpful. Especially the stuff about the ICD codes, not trying to keep them the same. So yeah, thank you very much.
Okay, so look, if there isn't anything else, I'm going to close the meeting and really appreciate the moms with kids who have transitioned to that you've come here and shared your experience and your insight and your knowledge with us. It's, as you can see, I mean, invaluable. I'm going to share this with your permission. Thank you very much. And I just appreciate your generosity and for asking the questions. The questions are really important. And I think what you said, Kath, also about approach, you know, how you approach the doctors, how you approach your children, how you approach this transition is actually really important.
Yeah, thank you.
Thank you.
Thanks
Thanks,
very much.
everybody.
Good
It was nice to see you all.
Bye.
Thank you, everyone.
Bye.
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 Bye-bye.